You know, there are new guidelines that will help identify children with behavioral problems. Natalie is in the Satellite Center with your HeathLink.
Brent, research shows that only 1 in 8 kids actually gets proper treatment for behavioral disorders. In fact, the American Academy of Pediatrics is now giving doctors a blueprint to identify at-risk children. Their new report explains how to better screen for disorders and intervene before problems become more serious. The American Academy of Pediatrics has long spoken out against medical marijuana for children, but now the organization says there may be some exceptions for kids with debilitating diseases. That said, the group still opposes its use and wants more research on how the plant's chemicals affect young people. Many breast cancer patients need to be more educated about their condition, according to a new study. Researchers asked 500 patients questions about their disease, but many of the women did not know the specific details about their tumors. And doctors emphasize that knowledge is key there. Well, let's go ahead and send it back to you, Brent. Now we have a warning for expectant mothers about those keepsake monograms.
Yeah, over the last several years, businesses that offer 3D or 4D sonograms have been growing in popularity. But as Lauren Leah explains, the FDA warns you to avoid them.
Brittany Erickson couldn't wait to find out if Grant will have a little brother or sister.
And I was about 17 weeks along and didn't want to wait any longer. So I did some research online and came across Baby Vision.
She found out she was having a boy and also got a 4D ultrasound, which shows a detailed picture of the baby's face and body.
The sonogram itself was really quick. He got to the point. I mean, we were here to find the gender and we found it right away.
But if you're going to have an ultrasound, it should be appropriately timed. We don't do anything over 15 minutes because there's a rule called the Allura rule, which is as low as reasonably achievable.
The FDA is warning women to avoid keepsake ultrasounds because they're not medically necessary and can last for 30 minutes or even an hour.
What the FDA is saying is that to do anything that's unnecessary when you're pregnant doesn't make sense.
Dr. Michael Burkus is with the UT Health Science Center, and he says there's no medical benefit to having a keepsake ultrasound, even though ultrasounds have been proven safe.
It is energy, so it's sound energy, and it does get into the cells, and in theory it's possible that there might be a problem.
Brian Salmon owns Baby Vision and says all of his staff members are medically trained, and he has this advice for moms to be like Brittany.
If you're going to a facility, make sure they have a local OB who is on their staff, and if they won't give you the name of their medical director, you know you're kind of dealing with something a little fishy.
You know, over the last, over the last several years, businesses that offer these 3D and 4D sonograms have been growing in popularity, so we'll see what happens from there.
See him on Facebook.
Yeah.